status of the people of Sierra Leone is one of the worst in the world. The country struggles with high rates of disease and death due to high communicable disease mortality rate, especially among infants. The fact that the communicable disease mortality rate is so high shows that the country has poor control over disease prevention and treatment. Some of the country's most dire public health issues can be linked to nutritional deficiencies, poor maternal care, undernourishment through childhood, and malaria.
Water quality, poor sanitation, hygiene, and low birth weight babies are the risk factors that cause the top 3 burden of disease that attribute to the most deaths lost. Malaria continues to be the leading cause of illness and death in the country. The government does little in terms of prevention and protection. The financing given to public health in Sierra Leone is simply not enough in addressing these issues, and as a result, the mortality rate of the country as a whole is still too high. About 41% of all hospital deaths among children under the age of 5 are due to malaria.
Women in Sierra Leone face multiple risk factors that can be attributed to poor maternal and perinatal health. The fertility rate in Sierra Leone is incredibly high. As a result, women on average are expected to have about 5 children in their lifetime. This is due to a lack of educational services surrounding safe sex practices and lack of access to family planning services. Only 8.2% of the Sierra Leone population was using contraceptives in 2008. This carries a huge toll on the health and capabilities of household income earners that are women. Most rural births are not even attended by health professionals, which severely increases the risk for labor complications. This factor severely compromises the health and safety of both the infant and the mother during childbirth and in the high-risk time period following. Steps that could be taken to reduce infant and maternal mortality should begin at the educational level. Rural villages do not have the same access to health facilities and therefore will need contraceptives to be brought to them rather than offered somewhere out of range of their access. Although kangaroo mother care is not promoted and is hardly practiced in Sierra Leone, many neonatal deaths could be avoided if kangaroo mother care was adopted as a regular practice for mothers with low birth weight infants. Finally, the introduction of ambulance services to rural areas could save many women from having to give birth without the presence of a skilled healthcare professional, which is a high contributor to perinatal and maternal deaths.
Statistically, the World Health Organization found that in the year 2014, there's about 75 cases of malaria per 1,000 people in Sierra Leone. Not to mention, the prevalence and death rates of this vector are rising as we speak. Malaria is of particular importance because of its easy and widespread route of transmission. Also, this disease is carried as a vector by mosquitoes. With regard to mosquitoes, Sierra Leone holds a copious amount of these malaria-carrying vectors as the country is burdened with an unsanitary environment and hot and humid weather. Our action plan is to gather money through donations, charities, and governments of more affluent countries. With this money, we will bring over doctors to cure the sick, but more importantly, educators to inform the nation of this disease. We will also use the money to build bed nets for people living in open tents and shelters. Another large part of this money will be used for careful and strategic spraying of DDT and pesticides over mosquito-infested areas. Hopefully, within a couple decades, we can bring malaria rates to less than half of what it is today.
The leading risk factor that contributes to the most burden of disease in Sierra Leone is childhood underweight, which is connected to nutritional deficiencies. Since nutritional deficiencies lead to many other health problems, such as night blindness and diarrheal diseases, addressing those issues at the source would have the most impact on the overall health state of Sierra Leone, and should therefore be prioritized. Nutritional deficiencies can cause growth and development issues in children, as well as making them more susceptible to illness, and having those illnesses last longer and have a bigger impact on their bodies because they don't have what they need to fight these illnesses. There is no one answer or easy fix to this problem. That's why we need to do something big. We need to focus our energy into an action plan that will help educate the people of Sierra Leone about not only health, but farming as well, so these people know how to support and nourish themselves.